It has now been 2 weeks since Kigali City went into total lockdown, and across the country, 90,339 COVID-19 tests were taken, with 4,200 positive results, or 4.6%. That increased active cases from 3,701 to 4,989, with 2,860 recoveries and 52 fatalities during the same period. Of the 4,200 new infections that were found countrywide, 2,207 or 52.5% were in Kigali City, and a shocking 90% of fatalities in Kigali. Health officials insist that the reason for such figures is not because most tests are taken in the capital.
That
was before, when we used the PCR method for testing, when there were 1 or 2 labs and the vast majority of tests carried out were close to those vicinities. Now, however, every health center in the country carries out tests. Rapid tests are being taken in all districts and provinces, and the latest figures reflect it, not just in Kigali. People no longer have to wait a long time to get their results either. And at government hospitals and health centers, testing is free. Here in Kigali, private clinics and hospitals usually charge around 10,000 Rwandan francs per test. The fact is, saying that most tests are carried out in Kigali cannot be the reason the city had most infections. If that was the case, then most fatalities would not be here either. Lockdown procedures, however difficult they may be to accept, have proved extremely effective when it comes to fighting the spread of the virus, something pandemic experts say is necessary. I doubt we see just how much these measures are affecting the country's economy the way top officials do. And they obviously are not happy about imposing total lockdowns which force people, the very people working to develop our country through economic growth, to remain at home doing nothing all day and not making a living for themselves as well. But a choice has to be made between putting the lives of people at risk and putting economic growth on hold until the threat has passed. Whatever decisions they make moving forward, it is clear that they as leaders have chosen to value human life over economic gain. Looking at the trend of the pandemic, new infections, critical cases and even fatalities. Indeed, health officials are urging people to be patient because the first vaccinations in the country will soon begin if nothing goes wrong. We are close to acquiring COVID vaccines. Now, however painful the restrictions we impose on ourselves as individuals or collectively as a country may be, they are like a bridge to get us safely to the time of those vaccines. Before, it was somewhat difficult dealing with these measures when a solution was not in sight, but not anymore. Today, even though we may still have fatalities, at least those that have not yet gotten sick will soon get vaccinated. Health authorities in Rwanda put the current COVID-19 test positivity rate at 4%, with a recovery rate at 66.4%.